to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, here today, once again, with Dr. Millicent Ravello.
Good evening.
How are you doing, Dr. Ravello?
I'm doing pretty well. I had a full day of cases today, which always puts me in a pretty good mood. So
What'd you do?
Doing all right. Well, funny that you should ask. I actually did
Was that funny? It wasn't
funny.
that funny.
It's not. Okay. Because you asked. I did a pretty extended tummy tuck today.
And we are talking about abdominoplasty.
Tummy tucks. Sure are.
So there you go. All right. So an extended tummy tuck.
Extended.
Like extended all the way around. Extended.
Well, it should have been. So a little bit off topic from what we're going to focus on this podcast. It was for a massive weight loss patient who just had a ton of skin. So we ended up doing what's called a fleur-de-lis abdominoplasty with a lot of liposuction as well. So
those are some big words for a girl from New Orleans.
Well, thank you. Thank you very much.
Fleur-de-lis. Of course, being that you made a cut up and down the abdomen,
right.
A vertical, along with the transverse horizontal, right. And then wrapped it around because it's an extended, because there's so much
there's a lot
extensive
skin. Of skin. I think I sewed maybe a half mile worth of skin today.
Somebody's got to do it, and that's good news.
But that's a whole topic for a different podcast.
Well, cool. Tell me then, if you can, the differences in the types of tummy tucks that we want to talk about.
So tummy tucks, or abdominoplasties, which is the medical term for them, really just mean that you are cutting out extra skin of the abdomen. And it's for women, men that have had, for whatever reason, extra skin that they can't get rid of by diet or exercise. And so there is a huge range of tummy tucks that can be done. And it ranges from what's called a mini tummy tuck, which is basically what it sounds like, to a standard tummy tuck, which we can go into detail on, to the very extensive ones, which I do for the massive weight loss patients, which is, like we said, a whole different ballgame.
And then the fleur-de-lis is
and then the fleur-de-lis.
That's when you're like pulling out all the stops.
Yes.
That's a big
That's when you're
tuck.
really committing to the tummy tuck.
But it's good. I mean, and that's the key is evaluation. In all things plastic surgery, it's making a diagnosis, evaluation, and making a plan based on where you want to get to.
Right. When you're talking about the tummy tuck, you have to talk about the scar, right? Because that's what people always ask about. That's what they want to know about. And so you have to know that you're going to commit to some level of scar. And that's where the mini to extended version comes in. So I think the question you have to ask on evaluation, who is a candidate for a tummy tuck? Why would we be doing it? So, who are the patients you usually get?
Well, I get a very wide range, anywhere from the massive weight loss patients who really need a lot of skin taken off to the moms who've had some babies and they don't like the C-section scar where the skin has kind of fallen over it, to like I lost all this weight but it doesn't go away from my abdomen, to the what I call the Newport Beach tummy tuck, which is that I just have my muscles have been destroyed by these babies and I don't have any skin to take away.
Right.
So there's a whole range, and the mini fits in there somewhere. And then there's something called the marriage abdominoplasty, which marries the mini tummy tuck with some aggressive liposuction. So it's all about fitting the operation to the patient's situation.
Right. And every patient's different, every body's different, so every surgery is going to be different. And I think that to start, let's talk about first the standard abdominoplasty and what that includes. And then we can sort of branch off into the different kinds and who might be a candidate for what. But for a standard abdominoplasty or a standard tummy tuck, this is going to be a patient that has a mild to moderate or large amount of extra skin, usually from pregnancy. It can just be from patients that are older and have developed loose skin over time. But usually it's from people who've had pregnancy or multiple babies. And so not only do they have extra skin, but they also have what we call a lax abdominal wall, or their six-pack muscles, which usually are tight and together, have been stretched out over time. And so they need to be brought back together. And then there's any given range of a little bit of extra fat as well. So generally speaking, a tummy tuck is going to include some version of liposuction. I usually do liposuction of at least the flanks on almost all my patients.
Agreed.
But sometimes I do it of the abdomen as well if needed. And then an incision on the lower abdomen, which usually goes, I tell my patients sort of hip to hip, like a little smile.
That's the standard.
At hip to hip, and I put it pretty low, so it's going to be hidden under your bikini. And then to really get all the extra skin out from the top of the sternum down to the lower abdomen, you have to what we call translocate the belly
bottom
button.
of the sternum.
The bottom. The bottom.
If you can get it from the top of the sternum, I want to see that. That's going to be.
I'm putting your chin on top of your pubis.
That's
no,
right.
No. The bottom of your sternum to the pubic bone. So we have to do what's called a translocation of the umbilicus or the belly button. And that's where you cut all the way around the belly button to sort of separate it from the abdominal skin and then pull all that upper abdominal skin over it and then make a new hole for it to come through.
Right. It's like a window shade coming down.
A window shade.
Poke the umbilicus, the belly button through the shade
through
itself.
A new opening, right. And then before we do all that, we do tighten up the muscles. We tie them together. We bring them in. Kind of think of it as like a internal corset, if you will, and bring those muscles back to the midline and strengthen them where they belong. And then you sew it up. And that's your basic tummy tuck.
Right. And it's really seen... men typically don't need the muscles put together unless they were heavy weightlifters or something and have really stretched out their six-pack muscles and have a big gap in between them. But mostly it's for women who've had babies, especially in the lower abdomen where, again, we've talked about this before on another podcast, where in the lower abdomen there's less abdominal wall because the abdomen is designed to stretch with the uterine growth.
Right.
So sewing those muscles back together really turns the flabdominals into the abdominals.
Right.
Again.
So that little pooch that you can get of the lower abdomen can really be improved by just tightening up those muscles. It just sort of cinches everything and tightens it back to where it belongs.
And it looks great. That's the bottom line. I mean, there are scars, but it looks amazing.
It does. And if you can wrap your head around the scars, then you can get an amazing result. That lasts. It really does last.
For sure. And you got to be okay with the scars because the scars are big. I mean, a hip-to-hip scar is legit.
Yeah.
Now, if you already have a C-section scar, then most people are saying, well, I'm already in for the C-section scar, so why not, go ahead and extend it and get a great-looking abdomen.
Right, which sort of brings us to the mini abdominoplasty. And the mini abdominoplasty is for a very specific subset of women. And why it's called a mini is because the scar can sometimes be smaller, or they're not always, but it's typically a little bit smaller, not quite as wide. But the main thing with the mini is that you're not making a new hole for the belly button.
You're leaving the belly button in place.
Right. So you're really addressing mainly the lower abdomen, everything below the belly button. So this is specific to women that don't have a lot of extra skin above the belly button and really just want to get that lower abdomen addressed.
And you can kind of figure that out by asking the patient to bend over into diver's position. Get them like they're up on the blocks to dive into a pool, and you can see if that upper abdomen hangs. It's going to hang after surgery if you do a mini. And then that falls under the category of mini operation, mini result. And that's no good.
Right.
So the upper abdominal laxity does not get addressed with this operation. And it's a total disaster when you don't do the right operation for an abdominal.
It really is. And
it's distressing.
It's bad. And I think, I will do the mini in the right patient. But I've had
I seem to always do it in the wrong patient.
I've kind of had, I was about to say, I was going to have sort of a bad taste in my mouth because I've sort of been pushed into doing mini abdominoplasties because patients didn't want to have the belly button scar.
Right.
And then I was always just really dissatisfied with the results.
Yep. I mean, you can't get the upper abdominal tightness that you get with a, but
looks
again,
really great. I mean, if you do it in the right patient and you really cinch that skin down and tighten up the muscles, the results are amazing. And the extra scar around the belly button, I think, is a minor, sacrifice to a really great result.
Well, it depends how you do it, though. I mean, I like to do a little chevron incision so that you get a little hooding.
That's what I do.
Do you really?
Yeah.
I think that's the way to do it.
I think that looks great. It gives great belly buttons.
And
I really like it.
You can hide the scar in there, and then you can do microneedling. Like, there's a lot you can do because the scars are there. I am not going to sit here and be like, oh, and you won't have any scars. You're going to have scars for sure. But the contour is ridiculous.
And I think that some people get scared because there are some, manufactured belly buttons out there, usually from older tummy tucks from the past, which do look awful. I'll give them that.
I've seen some that look
really
like a
large,
tortellini, actually.
like a silver dollar. Like they look bad. And
sunburst.
Yes.
Tortellini.
So yes, if you're
Silver
looking
dollar,
at
yeah.
those scars around the belly button, yeah, it can easily scare you.
Yeah, but I have seen some guys whose technique is to make it look like really odd, but then over time it like heals up, like especially the tortellini technique. There's one surgeon that comes to mind that must be Italian or something, but it just looks bizarre for a year. And my patients aren't willing to go a year for bizarre.
No,
bizarre.
bikini season's coming.
That's right.
Yeah.
At some point it is.
Right.
Well, that's good. And then the marriage abdominoplasty, I like to mention because that was like a Pittsburgh thing where it was a Ken Shestak paper, and it was, we did the mini, sewed the muscles from sternum to the pubis under endoscopic guidance, lifted it up, but aggressive suctioning of the upper abdomen and lower abdomen. And that would sometimes be okay.
Yeah. The problem with that, depending on who you're doing it in, I think my concern would be if you're really doing aggressive suctioning and you're tightening up those muscles, you're going to make whatever skin you have left there even more lax, especially if they've already had a baby.
Then
you're not taking it out.
No, I know. And
So that's my
believe
problem.
me, that's been that results in dissatisfaction.
Yeah. Well, we've talked about the mini. We talked about the standard abdominoplasty. Let's talk about recovery.
Recovery's tough. That's the
Yeah.
that's the trick. You need time to recover from this
need time.
operation.
Right.
You can't just like have this done on Monday and back to work on Friday.
No, in fact, you need a solid, I would say 2 weeks at least off.
2 weeks.
2 weeks is good.
That's
3
what I tell
if
my
you can
patients.
take it.
3 would be better, but 2 is
Right.
acceptable.
But really, no heavy lifting, no working out. I say for a good 6 to 8 weeks, which is a long time, but you want those scars to heal well. We've put your muscles back together, and if they have been really separated to start, you want those muscles to heal back together. So you can be back to work. You can do your activities of daily living 2-3 weeks, but really, I don't want any extra stress working out, weightlifting for a good 6 to 8 weeks.
Yeah, I mean that's key. You're going to have drains. So drains are
Or not.
Or not.
Or
There is
not.
drainless.
There
I
is
do
drainless.
drainless in select people.
I do them in select people, small amount of skin.
Right.
Yeah. Which is
not
not my
the
usual patient, unfortunately.
not the extended. I mean, because think how much you'd have to sew down. You'd be there
Yeah,
for
no.
17 hours trying to sew the flap down.
Yeah, no.
So what we're talking about is that we use drains when we pick up the skin and make a big space under the skin. We put in these tubes that suck the fluid out and get the skin to stick down to the musculature so that you are reconstructed.
Right.
If you aren't going to use drains, then you have to do like quilting sutures where you literally sew the skin flap down to the muscle fascia, which works great. I think it looks great. And you can do there's some tensioning things you can do to actually help the abdominoplasty result with the drainless tummy tuck, which again, I'll do in select people. I don't do it in everybody. And for some reason, those aren't my patients most of the time either. So I wind up using drains on the bigger undermining cases.
Right. Because the body's natural response to lifting up that much skin and doing all that work is to create fluid. That's sort of just a natural response. And that fluid has to go somewhere. So if you don't have drains in there, then you'll form a fluid collection called a seroma, which can be problematic. And then the drainless, which uses the quilting sutures, sort of eliminates that space. And that's why you don't have to use drains. And I really only do that for my small sort of mommy makeover, just had 1 or 2 babies, don't have a lot of skin kind of patients. But when you're dealing with large amounts of skin or you've done a lot of liposuction, I'm safer with a drain.
Yeah, and I've still had to drain seromas on drainless tummy tucks too. I mean, they still form fluid pockets. In fact, with drains, I rarely get a seroma.
Very rarely, yeah.
Rarely. But with drainless, I tend to get more seromas because you can't close all the space.
Right.
I mean, you can, but you're going to be there, again, for a very, very long time. It makes the operation unsafe, and I think it's bad for the skin, to tell you the truth. So I think, again, it's all about patient selection. It's about fitting the right operation to your patient situation.
Right. So I think we digress. We were talking about recovery. We're talking about the drains. That first week, I think we all do this. Your patients have to walk bent over because when you pull them down, to pull that skin as tight as you can, it's pretty painful to stand up straight. So my patients walk around sort of bent over at about 30 degrees. If I say the first week, they sleep in what I call the beach chair position, which is exactly what it sounds like. Your head's up, your feet are up, you got your pina colada in your hand, beach chair